There is so much beauty in our differences. No two people are alike, and each of us has characteristics that make us uniquely and distinctly us. But there's mystery in those differences too, especially when it comes to medicine. In the past, diagnostics allowed us to generally understand a disease, but analyzing, understanding, and treating its unique properties were out of reach. Until now. The future of healthcare is here. Diagnostics are an important part of every stage of medical care. In fact, 70% of medical decision-making is influenced by diagnostics, and that makes molecular diagnostics one of the most important advances in the last century. Simply put, molecular diagnostics are tests that detect specific genetic sequences and proteins to help make individualized and therefore more effective medical decisions for patients. The Society for Women's Health Research works to understand diseases and conditions that affect women more than or differently from men. We know that in every instance, from cardiovascular disease to cancers, molecular diagnostics provide the critical insights we need. This is particularly true when it comes to the challenges of ovarian cancer. We know that women with the BRCA gene mutation have a risk of up to 40% for developing ovarian cancer by age 70. But did you know that among those diagnosed with ovarian cancer, 60% do not get the professionally recommended standard of care? Many ovarian cancer patients do not have the appropriate specialist perform their first surgery. This can have a harmful impact on the chances of successful treatment. Molecular diagnostics bridges the gap between diagnosis and treatment with an FDA-cleared test that can identify ovarian cancer with 95% accuracy. Used with traditional cancer tests, this diagnostic helps physicians determine the most effective course of treatment and the right surgical specialists. This leads to improved quality of care and survival rates up to 30% better. The future is here. These advances revolutionize how we approach diagnosis and treatment of hundreds of diseases, including lung cancer, HIV/AIDS, cystic fibrosis, childhood cancers, and Alzheimer's. The Society for Women's Health Research believes in the promise of molecular diagnostics, which is improving the quality of life for millions of people. It's an exciting evolution in healthcare that is already transforming health in ways never before possible. To learn more about molecular diagnostics and the biological differences between women and men, visit swhr.org.